It is widely expected that children ages 5 to 11 will soon become the latest group to be eligible for COVID-19 vaccination in places like the US, while in South Africa, vaccination has started for children ages 12 to 17. But as a few other countries start vaccinating their children, some as low as 3 years, as the pandemic also continues, will that time come in Nigeria? When indeed? And the question really is when, considering the number or the supply of vaccines that we're getting. Well, joining us to talk more about this is Dr. Atinuke Uwaje. She's a consultant pediatrician, Pediatric Partners Hospital. She joins us virtually. Thank you for joining us on the program. I'd like to begin with asking first if perhaps we are witnessing, if you've experienced any, a higher number of children coming down with COVID-19 in Nigeria, like we're really seeing in other parts of the world.
Yes, we've actually the trend more kids testing positive for the COVID-19 virus infection. But just similar to the other parts of the country, to other parts of the world, we haven't had really severe cases where we needed to have so many cases being admitted. Or on the whole, most of the kids are pretty okay, even when they have the infection. Though we have a few that ended up with the multisystemic inflammatory complication of the COVID vaccine, COVID infection. So almost similar to what the other countries in the world are experiencing.
But perhaps not as much, like you've mentioned. But if we look at the problem of vaccine supplies in Nigeria and looking at how other countries are racing to vaccinate as much as their population, including the children, at what point do you see us getting our children vaccinated? This is in view of supplies on the one hand. Perhaps on the other hand will also be our virus curve.
Well, even if you look at our rate of vaccination for our adults, when we compare them to other countries, we're not where we really should be. But I know that a number of healthcare professionals were waiting to get the vaccines and encouraging parents to have their kids vaccinated. So once it's available, a number of us pediatricians and primary care physicians are really ready to get those vaccines in our children's arms.
Also, still with, vaccinating children, adults, some of them are definitely not happy with it, especially the fact that they're saying the vaccine mandates that we're seeing. Do you think that there might come that time where perhaps parents might also be hesitant? And there are some that exist for countries that are vaccinating children.
Well, if you look at vaccines in general, even for those ones that we know, they've been proven and tested, we still have some parents that have hesitancy in giving their kids those vaccines. One in case is the measles, mumps, and rubella. And the thoughts that this may actually be related or maybe a causative, may have some kind of causative effect on autism. So I'm sure that we're going to get a number of mothers, a number of parents who would be a little hesitant in us giving vaccines to their children. But I think on the long haul, that we as providers, we must believe in it. And then the ability, when we believe in the effects and the efficacy of vaccines, then we're able to also convince parents that, look, this is good for your child. I know a lot of families who have had one form of death or the other. I have had a personal experience. We're quick to want to vaccinate because, when we think that, if our family member had received this vaccine, perhaps they would still be with us today. And so we're having that conversation with our parents. And I know few parents have actually asked regarding the possibility of getting those vaccines to their kids. But I don't know, it depends on really what the government says regarding mandates. I know that even in a lot of these first world or developed countries, there are people who are actually taking those governments to court to question the mandate of those vaccines. So I'm hoping that we'll get a lot of people who would agree with vaccination, and hopefully we'll be able to at least get our so-called herd immunity, so that even if we have COVID-19 infection with us for a while, at least we have a lot of our kids protected, or even the general population protected.
That's very true. And finally, Dr. Waje, perhaps in 30 seconds, what's your advice to parents, to children, to adults, given the circumstance in Nigeria?
Well, I think, first of all, we need to continue to practice social distancing. We need to still, when we're in public places, to use our face masks. We need to practice healthy and good hand washing. I think those preventive measures are very, very important, not only in protecting us against COVID-19 virus, but actually in protecting us against so many infections. And really, that's what we pediatricians have said all along. Good hand washing, it does saves us from a lot of infections. So, and when the vaccine is available for our children, I'm going to encourage parents to please go ahead and get those vaccines for them. Thank you.
We appreciate your time. Thank you so much, Dr. Atinuke Waje, consultant pediatrician. Thank you for joining us on the program.